Hello, and welcome to Your Health Matters. I'm your host, Dr. Peter Hogenkamp, and today on the program, we're going to be discussing the health consequences of cannabis use. If you tuned in last month, you'll remember that I discussed the health consequences of moderate alcohol use. If you didn't tune in, I invite you to check out the PEG TV website or my website, which is Peter Hogenkamp Books, where you can find a link to the program. I wish you would. It's an important discussion that you might benefit from or one of your loved ones might benefit from. If you want, you can share the link with a loved one and give them the information that might help them in their health journey. I wanted to do these two programs back to back because both alcohol and cannabis are legal drugs in the state of Vermont and in 24 other states, Guam, the District of Columbia, and the Northern Mariana Islands. That's as of 2024. I think these numbers are changing. They're trending towards most states having legal marijuana. In fact, 54% of Americans live where marijuana is legal. 75% live in a state where marijuana is either legal or medically legal. Similarly, both alcohol and cannabis are considered to be safe, or at least generally not greatly harmful. Many people, I was just looking at some research, that 87% of people think that marijuana should be legalized across the country. Of note, it is not now. It's still federally illegal, even while it's still legal in 24 states, as I mentioned. So my mission today is that I want you to be aware that with the legalization of marijuana across the country have come a tidal wave of bad health outcomes associated with marijuana. And what I want to do, what I did last week, I hope, is I talked about the health consequences of moderate alcohol use. Because a lot of people were under the impression that moderate alcohol use wasn't bad for your health, and I hope I proved that to be not true last week. Today I want to talk about the cannabis use and the health outcomes associated with that. So let's start with the beginning. Let's start, what is marijuana? And I think most of us are familiar with marijuana. As I mentioned, it's legal and for 54% of Americans. It's also commonly used. In this country, the use of marijuana has increased 65% from 2015 to 2024. I point that out because this is the period of time during which a lot of states legalized marijuana, and the effect of that legalization was for more people to use it. I mean, I don't think this comes as any kind of surprise. In 2024, 25% of people used marijuana at least once during the year, and 15% of people use marijuana daily. And that's actually a higher daily rate than alcohol. There are some 52.5 to 64 million Americans who use marijuana monthly. So this is a subject that's relevant for everybody. This is not a drug that's not used. It's very common. It's in fact almost ubiquitous. It's been around for a long time. I remember marijuana use when kids were smoking marijuana in my high school back in the late 70s and early 80s. But as I mentioned, the use of marijuana has gone way up with legalization. The highest use of marijuana is among 18 to 25-year-old boys. The use goes down after that age, and it goes down with gender as well. Women tend to use less marijuana than men. An interesting statistic that I came across was 137 million Americans greater than the age of 12 use marijuana at least once in 2024. So we're talking about a widely used drug. What is marijuana? It's a botanically derived drug that comes from the plant which is called Cannabis sativa or Cannabis indica. These are the two main varieties of marijuana plant that people use. Most of the THC, which is the chemical that's the psychoactive compound in marijuana, comes from the flowers or the buds. Pot comes by a lot of different names. People call it, marijuana, ganja, Mary Jane, weed. I refer to it as cannabis, which is the medical term we use, and also it's the plant name as well. Marijuana or cannabis can be used a lot of different ways. Back in the old days, people smoked marijuana, and they still do. It's still the most common way to use marijuana. But it can also be vaped, and it can also be eaten or consumed in a drink. So there's a lot of different ways to consume marijuana. It should be noted that marijuana use is much higher in states where it's legal. It's next highest in states where it's medically legal, and it's lowest in states where this use is prohibited. I think that's common sense, but I think it's worth mentioning as many states consider legalizing marijuana. The perception is what I'm trying to get at today, and that is the perception that use of cannabis is not harmful. 87% of Americans support legalized marijuana across the country. This is a poll done by Pew Research, which is a very valid, reputable company. This is the perception that people have had for a long time. It's certainly the perception that people had during my younger years, where, oh, it's just a little pot, it's not harmful, let's not worry about it, blah, blah, blah. I'm sure we've all heard these various statements. But the thing I want to get at today is that marijuana of the 80s and earlier was greatly different than the marijuana of today's day and age. Why is that? Well, marijuana has become 3 times more potent. So what that means is your average cannabis plant has 3 times the concentration of the THC in it than it did back 30 years ago. This has a lot to do with various farming methods and that have similar to how we have more wheat yield, how cows produce more milk. All these various things that we've used to improve our farming methods over the years have resulted in cannabis is just a lot stronger. There's a lot more THC, which is the psychoactive compound in marijuana. The problem with that is that with the increased potency of the drug, we've now dealing with a lot more problems, especially problems in the addictive realm and in the realm of psychiatric problems. So when people try to tell you that marijuana is a safe and harmless drug, I think they're getting 50-year-old information. It's simply not the case anymore. And if I get that across, that one point across during this program, I'll consider my time to be well spent. Marijuana is not the same as it used to be. 1 out of 10 people that simply experiment with marijuana once will become addicted to marijuana. That's 1 out of 10. Now, when you're thinking about the numbers that I just gave you, back in 2024, 137 million Americans smoked marijuana at least once. 10% of that is 13 million. So we're talking about a significant number of people that either will become, have been, are, or will become addicted to marijuana. So, one of the other things I wanted to point out, along with legalization, have come some kind of unforeseen problems, and that's particularly in the edible market. It's amazing to me now that marijuana comes in edible gummies, how many people who wouldn't have used it are now using it. For instance, I had a patient come in very recently who was doing poorly, and it took me a while to discover, because she wasn't, because as a woman in her 80s, she was very hesitant to admit that she'd been using gummies from a dispensary. But she ended up having a significant number of problems from marijuana. It took me a while to figure it out because she never mentioned to me that she was taking gummies. So you're seeing marijuana use in people who didn't use it before. On the other end of the spectrum, you have pediatrics, and unfortunately, kids like gummies. I still don't know why gummy production was allowed, because it literally encourages kids to use marijuana. And that's, as I'll shortly discuss, that's what we don't want. The worst age for marijuana use is less than 25, because marijuana has significant effects on the developing brain that cannot be reversed. So now we're making marijuana in gummies, which appeal to young children. It's a disaster, in my opinion, and that's why I've named this episode "The Alarming Truth." The other thing to keep in mind is you're seeing some inadvertent poisonings. I happen to like the show The Pit, and I noticed one of the recent Pit episodes that I saw, there was a similar episode where a kid had gotten into his parents' marijuana gummies, and of course the kid's going to see a gummy and eat it. So the whole idea of these edible marijuana, drinkable marijuana, they make marijuana sodas. You're going to see a lot of inadvertent toxicology here. So the other point I wanted to make before we get into the kind of nuts and bolts of the side effects is this potency issue, which I alluded to either. I mentioned that marijuana is 3 times more concentrated. The THC is 3 times more concentrated than it used to be prior to the 90s. Another study, I found a 212% increase in the THC content in the marijuana flower between now and 1990. That's amazing. So you have to keep in mind that in many ways, all marijuana in today's day and age is high potency, all of it. Unless you've got some kind of heritage strain from a long time ago where that you're just keeping around, marijuana is a greatly different drug than it used to be, and we have to keep that in mind. Because with increased potency comes increased potential for addiction and the increased untoward side effects. Just to keep something in mind, edibles that people make, I looked it up. The standard edible is 10 milligrams of THC. You can get them as low as 5 milligrams. But they make high potency edibles that are very common. Some of them have 25 milligrams, some of them up to 100, and others even more. So you're talking about if someone were to get a hold of a package of a super high potency edibles, we're talking about overdose issues, which we've never had before. One of the reasons that people thought marijuana wasn't particularly harmful is that there was no overdose issues. And that's changed now because of the extreme potency of marijuana. All right, so I want to briefly touch upon the effects of marijuana on your physical health. This is not the focus or bulk of my talk, but I do want to mention it briefly. In the short term, marijuana or cannabis increases your heart rate up from 20 to 50 beats per minute. This can be quite dangerous in people who have cardiac problems or who have tachyarrhythmias, people who already have a high heart rate. Marijuana decreases your blood pressure, and this can lead to fainting. As many people know, it also causes a dry mouth and red eyes, as well as a decrease in coordination and a decrease in reaction time. Now, the dry mouth and the red eyes might be a problem for some people trying to disguise their use, but the decrease in coordination and the decrease in reaction time are a big problem for motor vehicle accidents. Obviously, one of the big problems with legalization of marijuana is that there's concern about people getting high and then driving, where there's an increase in accidents, where there's been an associated increase in accidents. In terms of long-term or chronic use, obviously for people that are smoking or vaping marijuana, there's lung problems. It's smoking just like any other ingredient, like smoking nicotine, cigarettes. There's an increase in lung infections. There's chronic cough that can be associated with marijuana use, and there's an increase in pulmonary mucus production. In terms of GI issues, these are probably the most common. People that use marijuana a lot oftentimes get nausea and vomiting that can become chronic and persistent, and they can also have weight loss and decrease in appetite. In terms of the brain, and this is really where things get, in my opinion, very tricky, because, as I mentioned, the most common age for marijuana use is 18 to 25. And your brain is not developed until it's at least 25, possibly now people are saying even 30 years of age. And the marijuana's effect on the developing brain, it causes impaired learning that doesn't reverse later. It causes decreases memory, and it causes decreased impulse control. Keeping in mind now that stopping the marijuana later on doesn't reverse these problems if you're using cannabis during your brain formation years, which go until you're at least 25 to 30. When it happens much earlier, for instance, they track marijuana use from age 12 up, it has even more of a profound effect on the brain. So, I do want to talk about addiction. As I mentioned, a lot of people's belief that you can't be addicted to marijuana, but I'm here to tell you as a practitioner of medicine for 30 years that is simply not true. Marijuana addiction is a very real problem, and it's a growing problem. As we legalize marijuana and it becomes more readily available and more socially acceptable, we're seeing more and more of these problems. So the risk of addiction goes up with earlier use. The earlier you start marijuana, the more likely you are to be addicted to it. Therefore, it's extremely important that we keep marijuana out of the high schools. I would argue that we keep, obviously I'm not a proponent of cannabis use, but it's extremely important when the kids not use it at those very young ages, 12 and up. Regular use increases addiction. High octane use. As I mentioned, almost all marijuana is high octane, but there are forms of marijuana that are available, I'll talk about this in a second, that are extremely high octane. The higher the potency, the more likely you are to become addicted. The other thing I wanted to mention is that people who use marijuana on a regular basis, even if they're not addicted, have a much higher risk of being addicted to other drugs like nicotine, marijuana, other drugs. So, cannabis use disorder is the term we use when people are addicted to cannabis. And you can find, if you're interested in the exact diagnosis, you can look up in the DSM-5, which is the Diagnostic and Statistical Manual, 5th edition, which we physicians use to actually make a mental health diagnosis. So to make the mental health diagnosis, you have to have some of the following things. I want to talk about them because you may recognize this in yourself. You may recognize this in a family member, a friend, an associate. So if this person has just two of the following things, we can then diagnose them with cannabis use disorder. So, a persistent desire or failed efforts to cut down, I think that speaks for itself. A person that spends a lot of time obtaining cannabis, using cannabis, or recovering from the effects of cannabis. A person whose recurrent use results in failure to fulfill obligations at school, work, or home. A person who's continued to use continues to cannabis despite persistent social and interpersonal problems caused by their cannabis use. A great example of this is I have a guy in my practice who's been dumped a number of times by his girlfriends. They all cite cannabis use. He's lost several jobs. They all cite cannabis use. He's in trouble. He's got all kinds of trouble with his family, all because of his cannabis use. I think that's fairly obvious that you'd, looking at this objectively, you'd see that this person has a problem, but this person doesn't see it. And I think a lot of that has to come with this perception that marijuana is not a drug that you can be addicted to. That's a perception I'm really trying to reverse. The last one was persistent cannabis use in physically hazardous situations. A great example of this is people that are driving with cannabis because they need to use it all the time or they have withdrawal. The last two ones, and they speak for themselves, but I'll mention them, would be people who are tolerant to the effects of cannabis. Tolerance is either a person's need to increase the amount of cannabis to achieve the desired effect, or a lesser effect with the same amount. That speaks for itself, but this is something that we see. Or withdrawal symptoms. People who need to either people who need to continue to use cannabis to prevent withdrawal, who are actually getting withdrawal. Withdrawal symptoms from cannabis, there's a number of them, although they all have the same kind of tenor to them. Decreased appetite, weight loss, irritability, sleeplessness, restlessness, anxiety, depression. Those are the withdrawal symptoms from alcohol. 30% of cannabis users, of regular cannabis users have cannabis use disorder, 30%. Remember earlier I said that 1 in 10 people who try marijuana at least once will end up becoming addicted, will have a cannabis use disorder. But of regular users, 30% have this. There are other diagnoses we make with cannabis, and one of them would be cannabis hyperemesis syndrome. I've seen this all too much, unfortunately, and that is kids with regular use of cannabis all of a sudden start vomiting, losing weight, they can't eat. It's a significant problem, and it's a problem that we see, again, more associated with these high potency cannabinoids. By the way, I somehow neglected to tell you about the different types of cannabis. In addition to smoking cannabis, people vape cannabis, and the vaping of cannabis is the number one way that people get high doses. Some of these vapes have 65 to 95% cannabis in them. There are syrups that people make that are concentrated, and there are things called wax and sheen. These are the names. I have never heard them before until my research, but apparently these are other products that are out there that are legal, where they have extremely high cannabis percentage, and these are the ones that are extremely dangerous. Having said that, remember now that in this day and age, all marijuana is high-octane cannabis. Alrighty, so let's go back to cannabis-associated disorders. And the one I'm really focusing on is the cannabis-induced psychotic disorder. I've been practicing for 30 years now, and just off the top of my head, I was able to think of 6 patients that I've been associated with, some way or the other, who have had this cannabis-induced psychotic disorder. Basically, what is it? Well, psychosis implies 3 things. It implies delusions, which are intense, irrational beliefs. It implies hallucinations, which is seeing things or hearing things that aren't there. And it involves paranoia, which is a certainty that others are trying to harm you. Cannabis-induced psychotic disorder also involves mood changes, especially emotional volatility, where a person can go from very happy to very sad very quickly. Obviously, that's not normal. Extreme anxiety and agitation. Who is at risk for cannabis-induced psychotic disorder? Well, I'm going to tell you the alarming truth, and that you probably won't like hearing, but that is that anybody that uses cannabis is can get it. There have been case studies where the first time people used cannabis, they actually developed cannabis-induced psychotic disorder. Let's go over some of the side effects of this. Is not a lot of fun. This is not a lot of laughs. There's no fun and games here. Delusions, hallucinations, paranoia. I don't know if you've ever seen a truly paranoid person, but they're not having any fun, trust me. This is an extreme and severe illness. Now, as I mentioned, anyone that smokes or uses cannabis even one time is eligible, but the people more likely to get this are people who are using it from a younger age, using it regularly, and using high potency type products, as I explained earlier. The last thing is that there's a tremendous genetic predisposition to this as well. So what does that mean? That means that if you have a family member that's had cannabis induced psychotic disorder, you are really best advised to never use cannabis. There was a study that was done in Canada and then one in England that confirmed it, but people with a certain genetic tendency towards this, when they use marijuana, they are 7 times more likely to develop psychosis than the average person. So we're talking about big numbers here. This is not, as I mentioned, I've known several cases of this disorder throughout my career. This is a very, very real thing. It's a very tragic thing. It destroys families. It destroys lives. Cannabis-induced psychotic disorder is a real problem. And unfortunately, as we see more and more use of cannabis and people using these higher and higher potency strains, we're going to see this problem more and more. So you can think of schizophrenia. So the symptoms of cannabis-induced psychotic disorder are similar to those of schizophrenia. I will say that the treatment for cannabis-induced psychotic disorder is to stop using cannabis. Most times, the symptoms will go away within days to weeks, although sometimes it takes months. And in some cases, I hate to say it, but some cases the delusions, the paranoia is permanent. Obviously, the treatment is to stop using cannabis. Unfortunately, that's where we get into trouble because people oftentimes get better and then they go back to using. Recurrent use is the best way to make this problem permanent, which is not something that you want to do. The other treatment that we use for this problem is antipsychotic medications. So we use the same medications that we use for schizophrenia that we do use for cannabis-induced psychotic disorder, but the best treatment remains cessation. And that's where we get into, that's where we have difficulties as practitioners, because I can prescribe a medication, it's something that I can do. And I know that the patient, at least will get the medication. That doesn't sometimes mean they're going to take it, but I can prescribe that medication. The real treatment is for that patient not to use that cannabis again, and that's where it's more difficult. I can urge the patient not to do that. I can recommend that they don't. I can strongly insist that they don't, but in the end, it's up to the patient kind of thing. And unfortunately, our research shows that a lot of patients who get this cannabis-induced psychotic disorder and who have resolving symptoms then go back and use again, which makes it much more likely for the symptoms to be recurrent. So, in the couple minutes I have left, I just wanted to reiterate what I was trying to do here today, and that is I was trying to reverse the misperception that marijuana use is safe or not greatly harmful. This phenomenon is because the legalization of marijuana has resulted in marijuana to be much more widely used than it was before. As I mentioned, in the last 10 years, marijuana use rates or cannabis use rates have gone up 62%. The bigger problem, however, as I have been discussing, is the increased potency of marijuana and cannabis. We talked about these extracts and these syrups and these vapes that you can get now that are legal and still sold in dispensaries, which are extremely high potency. I would ask you to avoid those and discourage their use among people that you know and love. The last thing, of course, is the effect of marijuana or cannabis on the developing brain. Where we really hate to see marijuana use is in these younger brains, where it can cause memory loss, loss of cognition, loss of impulse control. And remember now, when you use marijuana at that young age, these effects are permanent. Even if a person uses marijuana and then stops, the effect on the developing brain is permanent. So keep these things in mind. And again, I very much appreciate your attention. Please feel free to share the video if you have somebody that you think would benefit from this information. Cheers.